really what integrative medicine, what it brings to this, to pain medicine, to medicine in general, is really the culture change that the IOM has called for, that the Surgeon General's report on pain have called for, and even IHI, Institute for Healthcare Improvement, has called for. And it is the change in focus of what our medical system does. We don't really have currently in conventional care a real health care system. We have a disease management system. And what we're seeking to do is put health first. Let's try and see what we can do that's health promoting, that's health creating, because in fact, between 70 and 80% of our health outcomes are actually dictated by what we do, not by our genetics. So we have a lot of power to change our health outcomes based on what we eat, drink, think, feel, and do. And that's really the approach of integrative medicine, is looking at all the factors of the things we can do to improve our health. It has to do with the focus on disease, and if we go back to the origins of how we really started for medicine to really come to ascendancy, it was a magic bullet, a silver bullet model, where we had a dread disease like pneumonia that killed 50% of the people who got it, even if they were young and healthy. And we developed antibiotics, and suddenly that didn't happen anymore. Suddenly the death rate was very, very low, and people could survive that disease. And then there were the anesthetics and the surgeries that we could do because of anesthetics, and there were these miraculous changes that happened in healthcare as a result. The problem is that for certain acute things, that is the case, that model works. But for most of medicine now is all about chronic disease, and that model doesn't work for chronic disease. So we're still thinking of ourselves as gunslingers with the silver bullet, but the silver bullet doesn't hit the target anymore, and there's a lot of collateral damage as a result of some of the things that we do. And so pursuing health and looking at these complex problems that people are presenting us with, especially pain patients. They're extremely complex, and far too often we're settling for simple solutions, simple answers that aren't adequate for the complex problems that we have. Very good question. Pain scores themselves, the number on a 0 to 10 scale, I think are virtually useless. I think that it's nice to be able to feel you have something that is tangible, and that's a number. We're conditioned that way, but they really reflect function very, very poorly. And what we really want to know is, how are our patients doing? Not what number do they choose. I mean, people will choose a number based on their distress at that moment, and it may reflect pain or it may not reflect pain. I've had patients who've had a pain score of 8 out of 10 and have had perfectly functional lives, and I've had ones who are at 3 who can't get themselves out of bed in the morning. So pain scores have also encouraged, in the way that they have become used, they have encouraged more pain drug, opioid treatment in order to bring pain scores down to a particular level, feeling that that was accomplishing something. And often there is a lot of morbidity and mortality involved in bringing the pain score down, not an improvement in function. And we now know that people who are on especially high-dose opioids don't function as well. And there's some indication that even on lower-dose opioids, they interfere with long-term function when they're used long-term. You change your body chemistry every single time you eat. So based on what you choose to put on your plate and drink, you can either increase your inflammation or decrease your inflammation. If you're increasing it, you have the potential of increasing your pain, but also of interfering with the functions of healing that can go on in your body and the functions of energy production. So you want to be feeding your cells what they need. You want them to have good nutrition. You want them to have the least amount of toxic substances that can interfere with your function. And basically, vegetables and things that grow in the ground are the most efficient way of getting adequate nutrition. We tend to think of protein, we're a protein-centric society, and we tend to think of protein, particularly animal protein, as being the source of the best forms of nutrition, and in fact, they are not. Most forms of animal protein are high up on the food chain, and as a result of that, they contain more concentrated toxics. Things like PCBs, things like heavy metals can be contained in them, and pesticides. Whereas if you're eating the vegetables, you get much less of that toxic material, but you also get many more vitamins, flavonoids, minerals, and lots of fiber as well. All of those things are beneficial for decreasing inflammation. Right. Well, the answers are pretty simple. I like Michael Pollan's quote, eat food, not too much, mostly vegetables. It's very, very good advice, and it's simple. The problem is that food is more than just nutrition. Food is comfort. Food is a social activity. Food replaces social activities for people who are living in isolated, they don't necessarily have to, they can be in the middle of a big city, but they can be feeling isolated. And many of our patients, pain patients, do feel that way. Pain does that to them, but people in isolation also have the same parts of their brain lighting up when they check them on functional MRIs as people in pain. So those two things mirror each other very closely. And so there's so much more to what food means to people. So in trying to take away people's favorite foods is difficult, but it takes negotiation skills. So motivational interviewing and just trying to live in their world, try and figure out what their priorities are and couch it in terms that are meaningful to them. One of my best strategies is to get people to do food experiments. So they're not thinking that I'm trying to take away their donuts for breakfast forever. I'm just trying to get them to experiment with it for a week and suggest that maybe they don't want to drink 5 sodas a day for a little while. Let's wean you down for a little while, and then let's see how you do with that. And then most often people recognize what the impact of those foods are. Another strategy I use is to add things in before I take things away. So there are some people who are just really attached to their junk food, and the feeling I'm getting is that I'm not going to be able to negotiate this one. But I can get them to eat one vegetable every day. And I'll let them choose their vegetable of choice as long as it's not a potato or a French fry or corn. And they can eat the same one every day. I have different strategies, and you have to just get into the space of your patient and see what you can negotiate with them in order to get them to make those changes. And you have to take into account all the cultural meanings of food. And then if you have somebody who has an eating disorder, has had a past history of an eating disorder, you have to tread very, very carefully. But even that's doable. I think one of the most important things we can do is make our patients recognize that their actions have more impact upon their pain, what they experience, and how they function than anything we can do medically. In the vast majority of cases, of course. I mean, if you've got a fractured femur, that needs intervention medically. But for the vast majority of chronic pain patients, that's not the case. So the analogy I like to use is of going to the dentist. If you go to the dentist twice a year, but you never brush your teeth during the year, you're not going to have healthy teeth. In the same way, if you come to the doctor for pain treatments or the health professional for pain treatments or pain recommendations or medications, and you don't do anything to help your body function for the rest of the year, you're not going to get the results that you want. And that the focus needs to be on function. The focus should stop being on pain. We know we can improve function. We know we can get people moving, we can get their brains working, we can get them doing satisfying, meaningful things throughout their day. We can distract them from their pain. Focus on pain just entrenches them in the position where they get stuck and stops them thinking about their function. I mean, I get so many patients in who stopped thinking that they should seek out meaning in their life. And yet once they do, it just opens doors for them and they become much happier, more functional people, and they do focus less on pain, and generally their pain does go down.